So here's a problem to see if we can tie all this together in terms of coupled movements and head rotation. So we want to ask the question, if a cervical segment movement is coupled when it comes to side bending and rotation, how can someone keep their eyes level by rotating their head? So think about it. If you're standing there and you rotate to the right, your ears don't bend to the side, your head stays level. So how can that be true if there's this coupled motion? So we want to remember that the C2 through the C7 facet joints are angled at 45 degrees, and we can see that in this picture here. The 45 degrees refers to the plane of the facet joints from the lateral, or from a side view, relative to a line here drawn along the vertebral body. So here's your vertebral body, and this line is trying to approximate the inferior aspect of the body. It wouldn't matter if we drew it at the inferior aspect or the superior aspect of the body. The facet joints would still be approximately 45 degrees. And they're 45 degrees in flat in the medial lateral direction. That'll become important when we talk about the thoracic and lumbar spines. Nevertheless, that's their alignment here. And so we've talked about how then when you rotate a segment, facet joint for C2 to C7, if you rotate, so the right side, the left facet joint will ride superior and anterior, and the right facet joint will ride inferior and posterior. And that's what we mean by coupled movements. Okay, so here's the result of an experiment that actually tested right side bending and then quantified the amount of motion at each of the cervical segments. So here's the motion. So this is exactly what our problem stated, with the eyes are level and the head's held into side bending in this case, and it's right lateral side bending because we're looking at them. And so while the person was held in this position, they recorded the motions of the cervical spine. We can see here this is the occipital condyles on C1, and the C1 on C2, and so forth till we get to C7. And then we can see the different motions identified. Essentially, to the right is side flexion, and to the left is rotation and side bending to the opposite direction. Okay, and we can see here is that there's different amounts. So we have lateral bending in gray, and rotation here is in gray. This one, and then we have these small amounts of rotation here in blue. And then the white is flexion extension, so there's some extension and flexion as well too. So we're ignoring that and focusing in on the side bending for now. And so we can notice is that the dark gray here is what we want. So we can say, well, there's some side bending really at each segment, which is a little bit surprising. We get some at C1, C2, but there must be some tipping of those convex on convex joints that are going on. But it's really less than 2 degrees, because here's our x-axis here, which is how much motion is occurring. Right? So the central theme is that the sum of the side bending that occurs below C2 is really getting some contributions from each segment. We can see here there's 2 to 4 degrees. Here's 6 degrees from each segment. And so if we tallied all these, that would be about how much motion this man's getting in the lower cervical spine. And then the upper throws in a little bit. Okay, but what would also be the consequences? It would rotate the neck, the lower cervical spine is rotating to the same side, so they're side bending left. It's rotating left, so that what it allows him to keep his eyes level is he has to make some kind of compensation in the upper cervical spines. Because here we see here's a rotation here, a degree. There's 2, that's 3. There's 4, 5, 6. Okay. About 6 or 7 degrees. Well, that's more than compensated for by this 17 degrees of left rotation that occurs at the C1, C2 joint. So the bottom line is that whatever rotation is occurring in the coupled motions at the lower cervical spine, it can be accommodated for at the upper cervical spine. So you have this kind of contradictory movement that allows us to keep our head level when we need that.